it's very interesting to see that Thailand, under the UHC program, has been able to try as much as possible to be inclusive.
We thought that all the arrangements are quite in place, and then we saw the real hospitality of the people in here who arrange these kinds of things, and so we want to say thank you to all the people who involved in this process. I saw the solidarity of the Thai people, meaning that you have 1 million volunteers. It's very nice, and then the people would like to help the others who are in need. So in a sense of the solidarity, it's very good. Nowadays, it's very difficult to find in other countries.
Tied with the community. Community engagement is very, very beautiful thing here. Yeah, this is a good chance. It is the first time to be in Thai. Yeah, yeah. It's first time. Very, very happy.
When I came here, I have some impression about that prisons are not a good place, but my impression is changed. It looks very nice and organized prison with some humanitarian ground.
I think that what many countries can learn is the way that they have cultural education and make the facilities look nice around the prisoners. At least what they've shown us today is it doesn't look like a prison, and it's very beautiful, but we haven't seen the cells where they live, and we don't know all the corners of the prison, but what we have seen is nice.
and we look forward to continue hearing from your successes and then collaborate to also implement the good practices from here.
Saying at how impressed I was at the integration. We really have a complete vision that takes care from the community up to tertiary care and back down again. I think the things that you have done for task shifting and really rationalizing your resources is something to be learned, certainly where I come from, the United States.
This is my first time to join the PMAC 2020, and this is very first time to stay in Thailand as well. And people here are so amazing. They're so welcoming and they're so warm, and I love those people here. And I'm getting a lot more than I thought.
And I wanted to see how the primary care cluster in Thailand works, so we can also learn from the experience and talk about and see how to integrate our primary, secondary and tertiary care. But nonetheless, the fact that Thailand's doing UHC, there's a lot to learn from this. And it's always good to learn from what the other countries are doing. So not just from Thailand, I met a lot of people from Philippines, Cambodia and other countries where we feel that there's a lot of interlearning opportunities.
First of all, when I go back home, I will first of all try to share, the main lessons that I learned from Thailand, and I will try, as my role is also a researcher role, I will try to to put everything on the agenda of the policy makers to see if we can learn more from Thailand.
In my work, I'm interested in learning from other countries and taking those lessons back to the United States. And the examples that we saw in Thailand provide us some very interesting examples of things that can improve healthcare in our country.
Of course, the food is very good in Thailand. I think nobody will deny it. But I enjoy a lot meeting other people from different countries, sharing this extreme knowledge and experience. And that makes it so unique in the world. That is my fourth or fifth visit of PMAC. And I think that is the strength of PMAC. Getting so many experts together from different parts of the world and sharing all this amazing experience and knowledge. And I think that, again, is very unique in terms of public health.
I'm delighted to be given the opportunity to join this trip. I choose to sign this trip because I want to learn something about one-day surgery initiative that is being done in Thailand. And actually I want to know how this initiative that is being implemented in one hospital then being upscaled to many hospitals in Thailand.
So for me, two things I will take away. One, hospitals have to be very innovative in designing programs that address overcrowding. Second is the teamwork between doctors, nurses, anesthetists, and then fund managers in the hospital.
We came here with a lot of expectations about the innovations of this hospital and of the Thai health system, and this has been beyond our expectations. We want to thank all the hospital staff, the doctors, the nurses, for showing us all the work they have been doing, but especially the one-day surgery is a program that I think personally, that has a lot of potential to teach the world, to share with the world how to solve a problem that many countries have.
I experienced a lot of things. I'm a nurse, so I learned from a lot of nursing role in Thailand. For example, the one-day surgery unit, it is contribute to universal health coverage, and also I could discuss with nurses, so very practical comments I've learned from them.
I work in an organization that has a lot of interest in snake bites, and coming to PMAC was not only a good experience in terms of looking at how things work in Thailand, but also we know that the poison center that you have here, the producer KSMI is a reference center in the country, in the region, but also in the world, so it was a great opportunity to come and see how it works.
I've heard a lot of great things about the Thailand public health system, and I think a field trip would be the perfect opportunity to get to see it in action. Yes, very much. I was very impressed with everything, how they were, from what I've experienced before, a lot of doctors and health professionals in the Philippines are able to find ways to try to give care to their patients, but it's still quite fragmented, or maybe their expertise is isolated. And I'm really happy to see that here you've put that all together and made it a very comprehensive system that really allows the patient to focus on getting well, and they have a much better chance of coming out and living the rest of their lives well.
I've been attending PMAC for several times. This time it's interesting theme that I would like to understand more, which is the primary care trust, which is combination between the primary care and secondary tertiary care that produce efficient system. So this is a good system to reduce burden of hospital care and putting the burden distributed to primary care. This is essential. In Indonesia, we also use similar system, but in different way, especially in the scheme of payment. The payment for a hospital still the responsibility of the insurer, like here, National Health Security Office. But here, it's some burden of the secondary care is the responsibility of primary care. This will provide incentive to primary care to manage their people more effectively.
It's a great opportunity for us to have a field trip like this where we can learn directly from people who are implementing and living this every day and identifying the challenges and the solutions. And so our colleagues here today have done a very good job at explaining that to us in a way that I think regardless of the country, people can take lessons that they can think about and perhaps adapt in their own contexts. Thailand is one of the best examples in the world of making progress toward universal health coverage. I appreciate that the colleagues have told us that they don't have all the answers either, and there are still challenges that are faced by many other countries. One of them being how to cover and provide access to affordable health care for people who are not Thai citizens. So I think that was one of the challenges that came up.